this was a PowerPoint that I was working on. Hopefully, I'm going to be able to make a presentation to the City Council. And so I really want to emphasize the fact that, yes, it's beneficial for people, but it's also beneficial for the economy, which, it's important for us as a community. So Dr. Gabor Mate, renowned addiction expert, speaker, and author. Addiction is neither a choice nor a disease. It is the manifestation of emotional pain, of overwhelming stress, of lost connection with family, friends, with yourself. Whether it's an addiction to cigarettes, alcohol, overeating, or drugs, people who are addicted are traumatized people. Research has shown that there is a link between childhood trauma and substance misuse. Trauma can include physical, emotional, or sexual abuse, neglect, the loss of a parent, witnessing domestic or other physical violence. Vancouver's safe injection site, Insight, has been open since 2003 and has been shown to be a successful public health initiative in over 30 scientific research reports published in peer-reviewed medical journals. This research demonstrates that Insight users are more likely to seek long-term addiction treatment and to stay off the street than users who choose to inject outside. Instead of using puddle water from urine-soaked alleys, participants are provided with sterile water, which reduces various kinds of horrific infection. So that's an outdoor picture of Insight and a picture of the injection booths inside. And it's actually a 3-story building with the injection area on the main floor. Above it is a detox area, and then the third floor is a transitional housing facility. And this is from a nurse who works at Insight. Injection drug use is the outcome of systemic, familial, and individual influences that must not be oversimplified to, it's their fault, they should just quit and get a job. Having heard what many of these people have survived, I realize that they have far more strength than they are given credit for. I understand why they turn to drugs as a coping mechanism. Dulling the pain has become a way of survival. Dulling the pain has become a way of survival for many who come to our safe injection site. Appreciating this simple fact leads to understanding and compassion. So why am I here? Aren't I enabling drug users to continue their awful habits? Aren't I wasting charitable funds that could be directed to other projects and, let's acknowledge the implication, more worthy recipients? Use of safe injection sites protects substance users from overdoses and directs them to treatment options, which is the compassion we should show anyone in need of medical care. As is often said, addiction is a medical problem, not a moral problem. Insight is funded by taxpayers at a cost of $3 million Canadian per year. The facility says that for every tax dollar spent, 4 are saved by preventing expensive medical treatments for addicts further down the line. Insight, North America's first sanctioned supervised consumption site, saves the taxpayer system in excess of $6 million per year by preventing HIV infection and death, from a study in International Journal of Drug Policy, a cost-benefit and cost-effectiveness analysis of Vancouver's supervised injection facility, 2010. Data from Calgary. Since Calgary's supervised consumption site opened in 2018, the province of Alberta has saved over $2.3 million. A 2020 study by Dr. Jennifer Jackson from the University of Calgary was conducted as a way to quantify the financial impact consumption sites have on the healthcare system. The takeaway is that supervised consumption sites free up ambulances and decrease the number of people using emergency rooms. The benefits to Calgarians who don't use the site themselves go beyond the cost savings. Most Calgarians will need the emergency department at some point in their lives, Dr. Jackson said. None of us wants to wait for the care that we need. So if we can keep 700 people out of the emergency room, it means that anyone who needs emergency care will be seen faster. An important sidebar: no Canadian or international peer-reviewed study has found supervised consumption sites result in an increase in crime. And this comment from the Edmonton Police Service regarding safe consumption sites. Our observations and data indicate that these facilities collectively have not increased crime or disorder in the surrounding community. We acknowledge the fact that lives have been saved. It's important to note that credible evidence establishing that supervised consumption sites exacerbate neighborhood crime in Alberta, Canada, or elsewhere still does not exist. To date, 2021, peer-reviewed research has found no evidence linking supervised consumption sites to increased crime from a study in Harm Reduction Journal. From the New England Journal of Medicine, supervised injection facilities have been proven to reduce costs, and research findings on supervised injection facilities have been overwhelmingly favorable. Several countries, in addition to Canada, including Australia, the Netherlands, and Switzerland, have adopted this model. Studies have demonstrated that supervised injection facilities are cost-effective. And I found this site, and I'm just delving into it right now, but it's the Canadian Drug Policy Coalition, and the section that I'm looking at is dispelling myths and fears around harm reduction. And I thought this slide was instructive. Harm reduction and supervised consumption sites will attract more people who use drugs with crime into the neighborhood. In other words, a honeypot effect that's been shown to be a myth. Policing costs are reduced, and this was just something I found, but online. After heroin-assisted treatment was implemented in Switzerland, home thefts dropped by 98%. If you're someone who lives in a neighborhood with injection drug use and you don't like discarded syringes and seeing people shooting up on your street, then what you want in your facility is a supervised injection site. It makes, that should say community, I think. It's a supervised injection site. It makes communities safer and allows drug users to get the help they need. And this was really interesting. There's a huge site on the Simcoe Muskoka health units, are a huge they are pursuing it. The Simcoe Muskoka Health Unit is pursuing a supervised consumption or supervised injection site, and they have a lot of information, is what I was trying to say there. An area similar to ours, heavily dependent on tourism, Simcoe Muskoka, has moved forward on a plan for a supervised consumption site. Canadian Mental Health Association Simcoe County branch, in partnership with the Simcoe Muskoka District Health Unit, has submitted formal applications to the federal government for exemption under the Controlled Drugs and Substances Act through Health Canada, that's a requirement, and to the provincial government for funding approval for the proposed consumption and treatment service at 11 Innisfil Street in Barrie. The two agencies are working on behalf of the harm reduction pillar of the Simcoe Muskoka opioid strategy. Consumption and treatment services help save lives and create safer communities. They provide a clean, safe, and non-judgmental space for people to use their own drugs under the care of medical and non-medical staff. As relationships are developed with clients, they are offered referrals to primary care, treatment, and other health and social services. In Ontario, supervised consumption sites are referred to as consumption and treatment services. These names refer to the same services and can be used interchangeably. So this is a model really of what they're trying to do in Barrie. And just what we can hope to set up here. I have a dream that we could, KDSB would build a 3-story building on the old Northland Hotel site so that we could have injections on the main floor, detox on the 2nd floor, and transition on the 3rd floor. So I have written to Henry Wall about that. So cross your fingers on that one. And this is part of the research that Simcoe Muskoka did, a community survey on proposed locations for a supervised consumption site in Barrie. And so just to bring home the crisis that we have in Northwestern Ontario, this information comes from Public Health Ontario that from 2020 to 2021, in opioid-related deaths, there was an increase of 88.9%. So that is a crisis. And also, there's a similar graph that shows that hospitalization or emergency department visits increased in 1 year by 118.2%. That's for all of Northwestern Ontario, but I think Kenora and Sioux Lookout might be the areas with the biggest problems. So the solution, supervised consumption sites bring stability to the community by improving public order and reducing the number of injections taking place on the street. And we are looking, as Colleen Neal of the All Nations Health Partners said when we had a conversation about this, we're looking for a positive collective response to this from the community and hoping that we can move ahead with our own safe injection site.